Thank you very much. Thank you very much. And hi, everyone. I'm going to give you a bit of an update of what's going on COVID-wise and hone it down into some of our vaccine numbers. Today, the province showed 119 new cases, and that is the lowest number we've had in a while. We're hovering between the 160 and 195 mark, but again, way below the what we had, in March and April in the 4,000 range. So that is very good. Toronto and Peel still have the most. It seems to be coming down in Waterloo, where they had the Delta issues. Ottawa had 6, and we did not report any yesterday. However, over the last, I would say, a week and a half, we've had sporadic 0 to 1 cases, but we added a couple of cases, a total of 10 cases over the last week. There were actually 2 separate situations. One was, and all of which I want to say were not vaccinated, and they came into the region from other regions. And so it just shows the importance of vaccination. And one of them, like I said, is they're outbreak in a workplace, and another one is related to just a cluster in a family. Again, non-vaccinated, traveling from outside of our region, coming back to our region. So otherwise, we still at our very low number, and I want to continue doing so. One of the things that I just wanted to point out again is our cases, and I stressed, and I had a couple of questions from this. A, they were not from the NAV Center. Obviously, it had nothing to do with that. There was a question that was asked to me. B, they were not vaccinated, and so that brings me to the next point, where we know now there was a study that came out of Public Health Ontario that out of the 403,000 plus cases between the end December 2020 and July 10th now 2021, a couple of weeks ago, the 0.4% of those cases, 0.4% of those cases were in vaccinated individuals. In other words, 99.6% of the cases of COVID cases, all of the COVID cases in Ontario, were in unvaccinated or partially vaccinated individuals. And as a matter of fact, if one individual the people that received 1 dose, they made up 4% of the cases. And again, over 90% of the cases that we've had in Ontario are in unvaccinated. So the pandemic is becoming the pandemic of the unvaccinated. And so we are now really trying to work with everybody to try to increase our numbers and try to get them to the level where we want to be able to offset any 4th wave. So I'm going to just share an update slide that I put together for last week, and I'm going to do it on a regular basis for everybody. This one here just brings us to basically the overall number of vaccines that we've delivered. We've delivered close to 258,000 vaccines in our area, almost 145,000 first doses, which is 80%. Actually closer to 81% in adults, and close to 79% in terms of 12 plus. And again, we've vaccinated 113,000 individuals with a second dose, and that brings us to about 62% of fully vaccinated individuals. The next slide shows us again the percentage of doses by age group, and you could see in the dark blue is the first doses, and you could see that it's age dependent, but clearly over 40 and over, we're over 75% first dose. You can see that 30 and under, we're under that 60% mark for the first dose, but you can also see that we're catching up now with the light green here in terms of the second doses, and the second doses really are up in the 90s and high 80s, in the 60 and above, and you can see that we're catching up. So what we're doing is we're looking at catch up, and these individuals will catch up at some point, and we're hoping that again we'll have increased uptake in this age group for first dose, and also that we can catch up the second dose. I'll give you some more specifics. So overall, like I said, in July up until yesterday, we have administered 60,000 vaccines, that represents 17,000 more vaccines than we did. So we did 17,000 vaccines last week, and you could see that the sort of ups and downs, and you could see that the light green, this is the light teal here, is pharmacies. Green here is primary care, and blue is hospitals. So you could see collectively at some days we can vaccinate 4,000 people a day, which is a good number. If we look at first doses, last week we were at 142,000. Now we're at 144,000. So we administered another 2,000 first doses for a total of 5.8 thousand so far in July. We're close to 81% for first dose for the 18 plus, and hovering at the 79% mark for 12 plus. And I'll talk a bit about that later because of the targets that have been set by the ministry. Again, you could see that most of our doses were given between May and June here, but you could see that we're giving 100 to 200 a day, which is good because we need to move forward on that to bring up our levels as much as we can. The second dose, again, last week we were at 98,500. This week we're at 113,000. So we delivered about 15,000 second doses to bring us to 55,000 second doses delivered just in July alone. And again, you could see sort of the preponderance there. This last slide is a new slide that we put together. Actually, I showed a version of this last week, and what we're saying is we know now that the targets are set. I want to again stress. I stressed it last week as well. The targets for us to go beyond step 3 are set by the ministry, and what they've shown is they said that we wanted to be at 80% of the 12 plus population vaccinated first dose, and 75% of the same population 12 plus vaccinated with the second dose, 2 doses, like fully vaccinated. And so for us, right now we have 144,000 first doses, and we need less than 2,000 to bring us up to that full 80% of the 12 plus. And we're vaccinating a couple hundred a day, so I think we're fine with that. We'll get that very shortly. What I want to bring to your attention here is that second doses are the 75% mark. Again, that is the mark to go to step 3. I want to go higher, obviously, but just to bring us to the step 3, our goal is really to have 75%, which is about 137,000 doses. So far, we've administered 113,000. We're about 24,000 short of that goal, and so that I want to be able to, even if we don't get more first doses, you can see that we got another 25,000-30,000 people that need their second dose. So please go get your second dose as quickly as you can. All our clinics now are walk-ins. We have many clinics between now and the end of this month and into August as well. Right now we have several thousand available out of the 8,000 that we have this week. Through the 30th, and we know that in there's 400 or 500 first doses, and the remainder are second doses. So even like I said, my plea to everybody would be to go, if you're in that remainder, if you're part of that 20, that remainder of that 144,000 that have not got their second dose, please go ahead and get it booked. We're working now with the ministry to get those individuals who had appointments post in September to move them up to get it done earlier. So to me, that's very important that we do that. It's also important, again, to note that if we reach the 144 or 145,000 mark, we will easily be at over 80% second dose, which is great. And that's a very high rate of second dose. Again, this is a baseline to be able to protect our community moving forward. So to me, that's important, and it's just worth repeating over and over again that we're pretty close, and we got a small ways to go here. Like I said, we deliver 17,000 a week, so in a week and a half at this rate, we can be at both our goals easily. easily. And so it's very important. Again, even if we don't increase the number of first doses, which I do want to go, but even if these individuals, 144,000 individuals, all got their second dose, we're very good. We're in a good stead in about a 7 to 10 day period. We can get it done. So that's what I wanted to talk about, and I'm going to be answering some questions later. But again, I want to stress that this is a pandemic of the non-vaccinated individuals. We know that over 99% of the cases, 99.6% of the cases are in non-vaccinated individuals, and what we're seeing locally is the same. So if we want to protect ourselves and our families, and again, quickly get out of these restrictions and go into much more normal life, we need to get vaccinated. Very simple. Get your first shot if you haven't got it already, and if you got your first shot, don't wait. Within 28 days, you can get your second shot. Bonjour tout le monde, je vais commencer avec les chiffres ontariens. On a augmenté de 119 cas depuis les jours précédents à travers l'Ontario. C'est un très bon chiffre. En effet, la semaine passée, on a été entre 160 et 195. Et ceci est beaucoup plus bas qu'on avait en mois de mars-avril où on avait 4000 quelques par jour. Donc, ça va très bien. Au niveau de l'hospitalisation, ça va encore bas. Dans notre région, nous avons on n'a eu aucun cas pour quelques jours. Là, on a ajouté, je pense, une dizaine de cas divisés dans deux groupes. Un groupe était une flambée dans un commerce qui était en effet importé dehors de notre région. Et on a un autre aussi, encore, les personnes étaient en dehors de notre région, ils ont retourné, c'est une famille avec 5 personnes. Donc, on a une dizaine de cas depuis les derniers 3-4 jours qu'on a ajoutés et aucun n'était vacciné. Ça, c'est important à souligner qu'aucun était vacciné pour COVID. Donc, c'est très important de ça. On n'a pas des flambées dans des maisons de retraite ou des maisons de longue durée et on n'a aucune hospitalisation dans notre région, donc tout va bien. Donc, sauf ces deux différents cas, situation des cas ensemble, on n'a eu aucun autre cas dans notre région, qui est très bonne pour nous. Donc, il faut continuer. Donc, j'aimerais parler maintenant au niveau des vaccins. Ontario, Public Health Ontario, Santé publique Ontario, il y a un rapport qui a compté, qui en effet, parmi les 400 000 plus cas de COVID en Ontario entre décembre 2020 et le 10 juillet 2021, 99,6% de ces cas étaient pas vaccinés. 0,4% étaient vaccinés. Donc, pour vous dire que on a une très bonne protection et je peux vous dire que 4% avaient reçu une dose seulement. Donc, encore une dose à protéger parce que 96% n'étaient pas vaccinés avec même une dose. Donc, c'est très facile à comprendre que le vaccin vraiment va nous protéger, mais il faut qu'on ait les deux doses ensemble. Donc, ça, c'est un très bon message, un message qui est clair à mon avis. Aussi, on voit le taux d'hospitalisation, le taux de mortalité, tout a diminué de façon importante dans les personnes qui ont été vaccinées 2 fois avec les 2 doses. Donc, c'est très important qu'on continue. Donc, je vais vous montrer des statistiques dans notre région. Je vais commencer ici pour juste vous donner une idée de où on est avec ça. Et encore, comme j'ai souligné tantôt, les cas que nous avons dans notre région n'étaient pas vaccinés. Donc, ça, c'est un bon message pour nous. Depuis la semaine passée, on a vacciné presque 17 000 personnes de plus. On est rendu à 257 511 vaccins de données, 144 427 de première dose. Donc, ça nous rend à plus que 80 au niveau des personnes qui ont reçu une dose 18 ans et plus et presque 79 des personnes qui ont en total 12 ans et plus qui ont reçu. Vous voyez au niveau des vaccins, deuxième dose, on est rendu à 113 000. On a 30 000 à rattraper, si vous voulez. On est rendu à 65 et 62 des 12 ans et plus au niveau de le pourcentage des personnes vaccinées dans notre région. Ici, on a le pourcentage par âge au niveau des vaccins. Donc, ici, le bleu foncé, c'est la première dose. Et ici, la couleur vert, légère vert, c'est la deuxième dose. Vous voyez, dans les personnes âgées, effectivement, plus que 50 ans, on voit une très bonne pourcentage. Vous voyez que ici, ça commence à augmenter. Bientôt, on va être au même niveau avec tout à ce moment-là, parce que ces personnes vont sûrement recevoir leur dose dans les prochaines semaines, deuxième dose. Mais vous voyez qu'encore au niveau des personnes en bas de 30 ans, on a vraiment des personnes, on a du travail à faire avec cette population. Voilà ici, juste pour vous donner une idée, en mois de juillet jusqu'à date de hier, on a donné 60 000 vaccins en total, ce qui représente 17 000 plus que la semaine passée. Si on va aux premières doses, vous voyez, on était à 142 000 la semaine passée, donc on a 2 000 de plus, on est à 144 427, soit 81 des personnes 18 ans et plus et 79 des personnes 12 ans et plus. Ça, c'est les chiffres importants que je vais vous discuter, tantôt. Deuxième dose encore, on a fait du bon progrès. Vous voyez, on était à 98 541. La semaine passée, nous avons vacciné presque 15 000 personnes avec le deuxième dose. Puis là, on est rendu à 65 et à 62 chez les personnes 12 ans et plus. Mais on a du travail à faire encore, comme je vais vous montrer tantôt. Donc ici, vous voyez, on a ici la couverture vaccinale dans notre population ciblée. Il faut dire que les cibles étaient établies par le gouvernement d'Ontario pour assurer, au-delà qu'on passe au-delà de l'étape 3 d'ici quelques semaines. Donc, ça prend 80 de la population d'être vaccinée première dose et 75 de la population d'être vaccinée avec la deuxième dose. Donc, vous voyez, on est pas mal proche au niveau de... on a à peine 2000 vaccins à donner pour qu'on puisse aller cibler ici 80 Et vous voyez, on a encore un peu du travail à faire pour nous rendre la population 75 pour le deuxième dose. Encore, ça, c'est les cibles établies du gouvernement. Donc, on a un peu de travail à faire, mais on pourrait le faire. On peut vacciner facilement 15 à 17 000 par semaine. Donc, dans 2 semaines, on va être là. Moins de 2 semaines, 7 à 10 jours, à mon avis. Qu'est-ce qu'on voit ici? C'est aussi qu'il y en a 144 000 personnes qui ont reçu la première dose. Donc, si c'est même 144 000 personnes vont s'enregistrer pour les restants qui n'ont pas le deuxième dose. On va être facilement à 140 000 qui dépassent nos buts et qui vont être à l'approche de 80 deuxième dose, qui est une très bonne chose. J'ai dit tantôt, je pense que j'ai expliqué la semaine passée que ça, c'est ciblé pour qu'on puisse passer de là du troisième étape, mais nous, on veut aller plus haut. Mais si on a un bon pourcentage, 80 à peu près 80 avec 2 doses, ça, c'est très bon pour nous et ça va nous assurer qu'on n'aura pas une grande quatrième vague si on aura une. On voit à travers du monde, le plus les personnes ne sont pas vaccinées, le plus qu'on voit, en effet, aux États, si vous comparez, juste un État, je pense, Missouri avait 7 000 cas par jour. Nous, en Canada, on a 300 cas par jour. En Canada, Missouri a à peine, je pense, 4 millions de personnes. Donc, vous voyez, et il y a un taux de pourcentage de vaccins très faible, je pense, 25 la population. Donc, c'est une question de mathématiques. Si, disons, on a une population de comme en Ontario, on a à peu près 14 millions. Déjà, nous avons vacciné 10 millions à peu près. Si on vaccine 10 millions, il reste 4 millions qui n'étaient pas vaccinés, malgré que ça fait à peu près 80% de la population, disons. Mais parmi les 4 millions, il y a à peu près 1,5 million qui ne pourront pas être vaccinés parce qu'ils sont jeunes ou ils ont un problème médical. Donc, ça nous reste 2,5 millions de personnes qui ne sont pas vaccinées. Imaginez-vous qui devient tout malade, ça va aussi causer une surcharge de notre système. C'est pour ça qu'il faut diminuer, il faut avoir le chiffre qui n'est pas vacciné devrait diminuer. Autrement dit, il faut vacciner plus de gens. Mais pour nous rendre aux troisième étape, ou sortir de troisième étape, ça, je pense qu'on est proche. Donc, n'oubliez pas que, encore, je veux le souligner, c'est une pandémie des personnes non vaccinées et nous avons la prévention en main. On a besoin de donner une deuxième dose. Donc, si vous pensez ou si vous hésitez, je peux vous dire, je vous encourage d'aller avoir votre première dose. Si vous avez eu votre première dose, allez le plus vite possible de recevoir votre deuxième dose. Nous avons à peu près, on avait avant 11 000, c'est à peu près 8 000 personnes qui ont eu leur rendez-vous pour deuxième dose en mois de septembre. Tout va être avancé, qu'on puisse aller le plus vite possible pour atteindre les cibles qu'on a pour sortir, mais pour continuer. On va continuer avec nos vaccins. Les vaccins vont être disponibles encore aux pharmacies, malgré que si on arrête au niveau de nos cliniques de massimisation, ils vont être disponibles. So I'm just going to look at some of the questions here and move forward. I asked about a question here about the cases I answered. The other cases, once the mass vaccination clinics end, we'll be redeploying resources to address other effects of the pandemic, such as negative impact of the pandemic has on mental health and substance abuse. Yes, absolutely. We will be looking at that. We'll also be looking at catching up with childhood immunizations, school immunizations as well, and other programs. So we will be looking at that. At this point, like I said, our main goal is to get the vaccinations out so we can start getting some sense of normalcy, and then we will having a restoration of our programs. I want to stress here, Nick, that, you know, even if we have a high rate of vaccines, we're living in a pandemic world, right? And so with various levels of protection in other countries, and even in the United States, in the South. So we're still going to be surrounded by it. We're still going to get the odd breakthrough cases. We're still going to have precautions in place. But again, so we'll be still in pandemic mode, but we'll have a bit more time. And I guess, and I think because of the fact that we will be, you know, hopefully not seeing an increase in hospitalizations and an increase in cases that will overburden us, we'll be able to concentrate on these things of what I call the unwanted consequences of the pandemic. Got a question about masking. I know other provinces do it. They have removed mandates. I can tell you that we're looking at that as well. We're looking at that provincially, how we can progressively remove those mandates, those masking mandates. My opinion is that we're going to end up with masking only when it's crowded places, only if you're not fully vaccinated, or if you're immunocompromised, or if you're in a healthcare setting. So this is going to come. We're just looking at a sort of a provincial approach to that. I have another question here about vaccines, if they were vaccinated or not, and I said that they were not. There was a question, yes, there was a question about some anti-vaxxers using tactics. Those are not in our area, but they're done provincially. But in our area, we have no issues in that regard. There were some anti-vaxxers that were blocking clinics, making appointments and not showing up, but that hasn't occurred in our area significantly. Yeah, the other questions are all related to what I've answered. So Nick, we can open it up.
Okay, thank you, Dr. Paul. First question comes from Philip Blanchard, Morrisburg Leader. You can go ahead, Philip.
Good Good afternoon, Dr. Paul.
Hi, Philip.
So my first question, you said there's all 10 cases in the EOHU are either people who are unvaccinated or have only had one dose.
No.
How many of those 10?
No, they're all unvaccinated.
They're all unvaccinated. Okay, thank you. How many of those are under the age of 12?
2.
Okay, thank you. So second question, first dose rates are slowing and people under 40 are increasing, but not at the levels of the older populations. When do you think that do you think the location of the clinics have an effect on getting those people? And when are you going to start going more and more into the rural areas with clinics to try to get those people, either be due to accessibility or convenience issues?
That's our plan right now. We're working on that. We're working on areas like in Chesterville and those areas. That's what we're planning now. We're trying to have a wind down approach so we can have more what I call on the ground clinics, vaccine clinics and so on. We have an ambulance that can go around and vaccinate individuals. So those are the type of things we're looking at right now, Philip.
Okay. And talking with an MPP this past week, he said that the province probably won't release its back to school plan until a couple of weeks before classes return because health professionals want the most up-to-date data. Do you agree with waiting until so close to the beginning of the year to put out any kind of guidance or an idea for parents? And have you heard anything about what's going to be happening when we get back to September?
Well, I heard that the recommendations or the guidelines will come out imminently. I heard that they were going to come out before the end of this month. I think they need at least that amount of time to prepare. What I do hear as well is that there's going to be some continuation of masking. There's going to be attention on cohorts. There's going to be attention on and return to some curricular activities depending on the age groups, and also ventilation, HEPA filters, and those type of things. So I'm surprised to hear that they're going to come out that late. I spoke to Minister Lecce about a week and a half ago, and it sounded to me that they were imminently trying to put a program, put guidelines out.
Okay. One last one, if I've got the time here. You said earlier that this is a pandemic of the unvaccinated now, but do you think that might be stigmatizing people who can't receive a vaccine yet?
No, obviously, look, I mean, I don't mean it in that sense, and I don't want it to be misinterpreted that way. I mean, people who choose not to be vaccinated should know that they could prevent COVID. Obviously, I don't want to stigmatize individuals. As a matter of fact, I want to increase the people who can get vaccinated to protect those that can't, i.e. medical conditions and so on. So I don't want to stigmatize individuals who are vaccinated, and I want to maybe reframe it and say people who voluntarily don't get vaccinated. Let's put it that way.
Okay, perfect. Thank you very much, Dr. Paul.
No problem.
So those are all the questions from the chat. Does anyone joining by phone have any questions? You can press *6 to unmute. Est-ce qu'il y a quelqu'un joint par la réunion par téléphone qui a des questions? Vous pouvez appuyer sur l'étoile 6 pour désactiver le mode silencieux. Those seem to be all the questions for today, Dr. Paul.
Thank you. Merci tout le monde.